Vincent Palaji is here, Anand Bhaskarji is here, Jasbir Gill, Geeta ji, here, and our distinguished parliamentarian Siddiqui ji is there, also Yadav ji is there, and many of these people have worked tirelessly in the last few years, particularly on the policy. And policy is the fundamental of everything that happens. And with their efforts, they have been able to bring paradigm change in the way we handle TB. I remember years ago when I set up Global Coalition Against TB with support of very dear friends like Kalita and all of the senior parliamentarians. We really based everything on serological tests. Today we can proudly say we totally altered the system. We have gene expert machines. Then there was no use of ICT. We brought in use of ICT in treating people. And we had no research consortium for TB. We established National Research Consortium. Then there was nothing known as nutritional support in India. Nobody ever got support because everyone thought you will get our TB because you will give medicine for a period of 9 months. But everyone realized that nutritional support is very, very fundamental to treatment of TB. And like that, 70% of people in India are treated in the private sector. And because 70% are treated in the private sector, it was not possible for government, no matter how much infrastructure it expanded, to have the kind of outreach to least last mile. Even today, there are 1 million detected cases in India every year. Therefore, effort was made. I remember years ago, I was in Patna, and with support of all of you, we set up the pilot project. And from then on, we moved to Mehsana, we moved to Maharashtra, we moved to every part of India. And today, public-private partnership is almost the in thing today. Everyone talks about PPSA model. And that model, we are replicating in every part of India. The government itself is doing. They did a phenomenal JEET project in collaboration with civil society, Global Fund, and everyone. And that has paid dividends, and notifications are increased. So we have distinguished parliamentarians here. And before the Honorable Minister comes, we'd also like to hear them as to how they can really help us in building linkages within their own system, because elected representatives have a very important role to play. You know, legislators, cooperators, Panchayati Raj institutions, you have Gram Sabhas, you have Panchayats. Are we able to build a synergy between all of them? Because it's not people working in isolation that TB will come to an end. No matter how hard, because nowhere in the world any disease has ever been controlled or terminated without active engagement of the communities. The communities have to be engaged. Therefore, you people represent different areas, different social groups, different regions, maybe different states, and you work tirelessly in your respective constituencies. And we'll be very happy to hear your views on some of these areas. You know, village health committees, village sanitation committee, how you can bring synergy between Gram Sabha and Panchayati Raj institutions, and how, at what effort or what new rules or procedures are required to be changed at the government level, so that all of you can work together with a single focus of ending TB by 2025. So all of you are here, and Vincent Palaji, may we start with you?
Thank you, sir, for giving me the opportunity. Well, after being associated with GCAT for the last few years, I've been quite active in my own constituency as well as here in Delhi. What I could see or realize, especially in my state, Meghalaya, the stigmatism is very difficult because once you've been identified as a TB patient, then first the patient himself is feeling down, and the stigma within the locality, especially in areas where we have a small state and areas in tribal areas, I find that's more difficult. So until and unless we work together with the civil society, we work together with the Panchayati Raj, or we call it Dalbir society with health workers, I think it's very difficult to eliminate TB. So what I've experienced is that when working with the deputy commissioners at different districts, we really need the testing kits actually wherever they are. Many of the health workers, they used to, especially in the districts, they used to request us to give an ambulance equipped with the latest machine for testing. Also, refrigerators, like when they collect the sample, they can store it for a longer period of time, and then only they can test it. So these in the remote areas, I find it very difficult, and with limited fund, I find it very difficult. But even then, when we work together with the corporate societies, with the corporate companies and all, we used to manage some CSR fund or from the district Minerals Foundation fund, and also we could manage to do this. So I think in other consultancies, I don't know, it's different from one state to another state and from one district to another districts. But as far as in Meghalaya is concerned, is that with this COVID coming, I think it's more challenging for us. I don't know how other districts, how other consultancies are there. But in my own consultancies, I find it, the health workers are especially the ASHAs and all, are working very hard. And together with them only we can do. We as politicians, what we can do is only we can assist them in terms when we have a meeting in terms of awareness program. We can request the people, we can request the civil societies to work together. So our job are limited in these areas. So I'll be happy to listen more from the experts rather than speaking from here. Thank you very much.